Okay, so we are here with Kenneth Gamma, who's the Dean of Students at the Malawi College of Health Sciences. So, Kenneth, can you tell us a bit more about what your role is as Dean of Students at the Malawi College of Health Sciences?
Thank you. As the Dean of Students at Malawi College of Health Sciences, my role is mostly to look at the student welfare. Some students have special needs. Some students have got chronic sicknesses. They are all helped by my office, but above all, they also go through my office to lobby for scholarships for
Okay.
students. Yeah.
Okay, and the Malawi College of Health Sciences, what courses can a student study here?
Quite a variety of primary healthcare service delivery courses. Like we offer diploma in clinical medicine, diploma in biomedical sciences, diploma in environmental health, diploma in dental therapy, diploma in optometry, diploma in radiography, diploma in uh, diploma in anesthesia. We also offer courses like orthopedics and some certificate courses like clinical medicine, pharmacy. We also have.
Okay, so all the diploma level courses
Yes.
in Malawi, how long are they? What is the duration of the course?
They are, our college actually is three years.
Okay.
And these 3 years, we are talking of 10 months a year. So
Okay.
it's quite very
Quite
busy. It's
an
30
busy.
months
Yeah.
for you to graduate with a diploma course.
Okay.
Sure.
And for the students doing diploma courses, where do they go to work once they have finished?
Uh, Starting from primary healthcare. So like Malawi health system is divided into three. There's primary healthcare, secondary and tertiary. The secondary one are district hospitals. So our students work at each and every level.
Okay.
Sure.
Okay. And you said before that like 70% of health workers in Malawi have been trained at the Malawi College of Health Sciences.
Yes,
So,
we actually have other cadres that are 100%,
yeah.
like dental.
Yeah.
Dental is only done here in Malawi.
Yeah.
So if you meet someone offering dental services in Malawi, obviously has ever gone through this college.
Yeah.
Sure.
So this is an extremely important college for Malawi
Sure.
because yeah.
Actually, also looking at over 40% of health services as health service delivery uh, professional workers is not yet filled. We are still lacking 40%. So it's not just about what we have done, but what we are willing to do.
Yeah.
We still have a gap of 40% in our health facilities.
Yeah.
And that 40%, basically, 30 is coming from this college.
Yeah.
It has to come from College of Health Sciences.
That's a huge statistic. So 40% of places in the Malawi government health infrastructure
Yes.
are currently vacant.
Yes.
Meaning that every single student at this college is incredibly important because they will graduate and fill some of those spaces.
Definitely, very important.
Okay.
Sure. Okay, so our college is strategically placed to support underprivileged students. Underprivileged in terms of they cannot access degree courses where they are offered in Malawi, and also this college was fully funded by government. They would access the underprivileged in the sense that they cannot afford almost any amount of tuition fee. Unfortunately, a few years ago, government pulled out scholarships to students. Therefore, our students have to look for 550,000 per academic year to pay school fees.
Okay.
And as I'm talking, this is the final semester of the year, and not even half of the students have paid half of the tuition fee.
So so 550,000 Malawi kwacha in context is in the current exchange rates in the region of about 480, I think, pounds.
Yes.
Um, so it's £480 to study for 1 year at
Yes,
this institution,
that's true.
and the diploma level students, they are the ones that are providing the majority of healthcare in Malawi.
That's
so they
true.
are
Even
incredibly
at tertiary
important.
level.
Yeah.
Even at tertiary level.
Even at tertiary level. Yeah.
Yes.
Okay, and so for how do the students find the money? If you're from a poor family, like what are the challenges? What are the options for the students?
Most of them, they are, because Malawi still, we still have vacant of land. Some of them, they are to sell land permanently, and most of the people that are buying land are not even Malawians. So they have to sell land permanently to pay, to find the 550,000 to pay for tuition fee. But that is not enough, because as I'm talking, I have over 70 students that have requested to pull out because they can't totally manage to pay fees. We have girls. I had girls last 2 months in my office talking about the sexual harassment they are meeting. They were sent from another city like Blantyre to Lilongwe to be trained, but they would not find an accommodation. They have no money to pay for accommodation. A friend to a friend offered a place. A husband to the friend would want to sexually abuse the student, and with a lot of promises, and comes to my office. The student has nowhere to stay. We are to negotiate with our fellow lecturers so that we can pay for accommodation for such kind of victims. We have students that are walking over 15 kilometers to come to school because they can't afford accommodation nearby. And in fact, the college is at a place where there are no locations around. You are to walk about 5 kilometers to find a location, where also accommodation is quite expensive to our students. Our hostels can only accommodate just 3 quarters of the students, but the other quarter, they have to commute from the communities.
Yeah.
Sure.
And an accommodation in the capital city of Malawi is proportionately more expensive anyway because it's
Yes.
the capital.
Sure,
So
definitely.
if you're not from Lilongwe and you're traveling from a rural area, you're from a rural village, you are not only expected to pay for your tuition fees, which you can't afford, but you also have to pay for your accommodation, which is a lot higher and you might not be
And
able to
food
afford.
too.
And food, of course, yeah.
So food, like the caterers that are selling food here, it's about 60,000 Malawi
Per month.
per month.
Okay.
So at least those that are staying here, accommodation is a bit cheaper because it's 15,000 per month.
Mm-hmm.
But with the caliber of our students, some of our students are still struggling to pay that amount.
Yeah.
Sure.
And we know from our students at other colleges who are training that sometimes they can get the government loan for their
Yes.
fees. Are students able to get the government loan at this university, this college?
No, that's the most unfortunate part, because the definition of the higher education loan board of higher education is where you're offering degrees. So if we are not offering bachelors here, it means we are not in the category of higher learning, and that's in the Act of Parliament. It means the Parliament has to meet and change that clause. We've been to Parliament several times, but it's not working.
Yeah.
So our students are not beneficiaries
Yeah.
of the government loan.
That's very challenging for the students. So, how many other organisations are currently supporting students here at this college?
We only have USAID. USAID is supporting, like on this campus, about 40 students on selected departments, because them are running a project that is targeting primary health service delivery. So they are mostly offering scholarship to certificate courses, nursing and environmental health.
Okay.
So all the cadres are not covered.
Okay.
We have IZF. IZF is an Islamic institution. Them are offering scholarships to Islamic students. Currently, there are less than 10 that are beneficiaries of
Okay.
that kind of a scholarship.
Okay.
The rest is maybe a well-wisher somewhere, but not necessarily organizations.
Okay.
Sure.
So currently, you have almost half of your students at this university who are in need of help with school fees.
That's right.
Less than half have paid all of their balances for this year,
Yes.
but you only have approximately sort of 50 to 60 students who are on scholarships.
Yes, about 50.
Yeah. Okay, so there is a huge need for more scholarships for students that are struggling.
Definitely. Because if you are talking about 820, it means about 400
Yeah.
are needed students.
Yeah.
They are needed students. So if we only 50 are covered, We have 450.
Yeah, absolutely. It's a huge
Sure.
need.
So basically, the college policy is when we are starting an academic year, each and every student should pay half of a semester fees, which is half of 275,000. But it happened this year that not even half of the students have paid. And you have a class of 40 students, only 10 have managed the requirement to register. Now that puts an academic dilemma, the college into an academic dilemma, to say, should we not start teaching because uh, most of the students have not paid? What about those that have paid? Do we punish them too? Because it's more like you are punishing those that have paid to say we cannot teach you because your friends, which are more than half of the class, have not paid. So that dilemma, the college had no choice but to continue administering education, but putting itself under pressure to say how do they find money to support students. Because what government give this college is what we call ORT, other recurrent services. Okay, like paying part of water bills, part of electricity, but the actual learning of the college depends on the school fees. So really this challenge is also burdening the college. Is also burdening the college.
Yeah,
It's more like the college should be closed
yeah,
because nobody can afford it. So it's more like that kind of a situation. But looking at 40% out there are waiting for, if you go to the hospitals, you still find lines and lines of patients because the patient doctor ratio is not even close to half.
yeah,
Sure.
yeah. There are many challenges.
Quite many.
Yeah.
Quite many.
Medic to Medic provide holistic scholarships to students in need. We guarantee tuition fees until the end of graduation, provide a once a semester allowance for stationery and living directly to the student through bank transfer, provide a medical equipment pack, medical books, and laptop so that students have everything they need to reach their full potential and successfully qualify as health workers and role models to their communities. Our graduates are actively involved in fundraising and providing mentorship to students in country. Can you help us provide support to more students in need where they are needed most? Poverty limits choices. Help us expand our scholarships to more students in need so they can help their communities now and in the future. You don't have to donate a lot to make a meaningful difference. Regular donations help us plan our activities well ahead of time, and we appreciate every single one of them.